I'm a red hot mama from my head to my feet. Sassy and brassy, so sexy and sweet. Oh, come a little closer.
Hi everyone, I'm Dr. Seibel, and I hope you enjoyed that little snippet of Red Hot Mama. It's a song I wrote for women is because of all the hot flashes, because I would say of all the things that women complain of, hot flashes is the #1 thing. It's hard to not notice them because they're so visible not only to you, but also to everyone around you. And it's important because they can be embarrassing, they can trigger at odd times and make everyone aware that, oh, she's going through menopause. The other thing is it can be at a private matter very disruptive, because who can sleep when they're feeling all this heat coming through their body? Let's talk for a second, because I'd like to explain to you what is a hot flash. Basically what happens is in the transition between reproduction and menopause, the regulator of our body's heat in the brain becomes kind of like a thermostat that's not working properly. Normally we're always in control with heat release and we always are temperature regulated, but in the transition into menopause, that thermostat gets broken just a little bit so that it misfires. And what happens is, all of a sudden, there's a tremendous release of heat. Women usually say it starts at the waist and goes up their chest. And what's really happening is the veins of the body are dilating. The blood vessels are dilating. With the dilation comes a tremendous release of heat. Because if you notice your veins get big when you sweat and you see them get bigger, it's a sudden burst of heat release. Now that heat release can then cause the woman to sweat. And when you sweat, it evaporates. And when it evaporates, you feel cold. So it's this constant change of heat release, evaporation, and coolness. Now for some people, this can happen only a few times a day, but for other people, this can happen every hour, sometimes even more, and it's incredibly disruptive, and that's what brings people in for treatment. Totally understandable. There are several things that can trigger hot flashes. Now you may notice that it could be something as simple as caffeine, or it could be hot spicy foods. You may notice that there are stressors that get you. For instance, if you get upset or anxious or nervous, those could be triggers. It could be alcohol. It could be any of a number of things. What I think you will notice is if you really pay close attention, there are often personal triggers, and those are the things that you notice that for you specifically are setting up those hot flashes. So be aware of those personal triggers and try to avoid them. What can you do to try and deal with hot flashes? Well, I'd like to start with some very simple things, because it's always best to start with the simple things. We've already mentioned these personal triggers, so avoid those. That goes without saying. Now another thing that you can do is to exercise regularly. One of the best things that helps women as they transition to start to have these hot flashes is just keep exercising. You don't have to do a marathon. What you can do is just simply go for a walk every day. Take the stairs instead of the elevator if it's only a flight or two. You can, at work, just keep moving around all the time. Exercise definitely reduces the intensity and the frequency of hot flashes. Another thing that's very important is to stay hydrated. Try to drink between 8 and 10 glasses of water a day. For some people that seems like an awful lot, but remember, your body is about 85% water. It needs water to stay hydrated, and hydration helps to prevent hot flashes. Something very simple that you can do. Another thing that you can do is stay cool. You'll find that some people, when they get into a heat situation, whenever the temperature increases, they start to have hot flashes. This is particularly difficult for women who live in the South or in warm temperatures, but some people have a hot trigger just by putting a hairdryer on their hair. So anything that you find that is a trigger is heat related, try and avoid it and try to stay cool. Another thing that you can do that's very helpful for a lot of people is to dress in layers. You know, when you start to have these hot flashes and this warmth, for some people it's going to happen like that. It's going to last only a few seconds, but for others it will last for several minutes. That's very common. So if you wear a jacket and then you have a layer over your shirt, so you have maybe a tank top underneath, etc., you can always take those different layers off down to the lower layer. And then when you start to cool off, you can put those layers back on. This is a very good trick for helping you to deal with a hot flash and to lower the intensity of it when it comes. Remember, hot flashes come with two parameters. First, they come with the frequency, and they come with the intensity. How hot, how worrisome is it? So sometimes the goal is not to get them to go away because it may not be possible. The goal is just to get them to come less often at wider intervals and to come less intensely. That's the kind of things that I want to try to help you with so we can achieve our end point, which is to help you sleep through the night and to avoid these embarrassing triggers during the day when everyone can see the hot flashes and when it feels awkward for you. Now, what are some of the other things that you can do to avoid hot flashes? Some of the common things that people do is over-the-counter remedies. One of the most popular and potentially helpful is that of soy. When you look at soy that's packaged over the counter, it basically comes in capsules usually, and it contains something called isoflavones, I-S-O-F-L-A-V-O-N-E-S. This is just one component of the soybean, and it is particularly helpful in lowering hot flashes. What I like to suggest is that the dosage of milligrams of isoflavones that you get in a day is somewhere between 25 and 100 milligrams over the course of the day. Try to avoid taking more than 200 milligrams because that's getting you out of the range of what's considered the dietary intake that people around the world eat. If you can, divide those dosages into two because soy lasts about 12 hours in the bloodstream, and if you divide one pill in the morning and one in the afternoon or evening or even at bedtime, you're going to spread out the benefit of the soy. If you get a soy textured protein, then what you can do is you find those also in health food stores, and they come in a can, kind of looks like a coffee can with a scoop. Generally those scoops have about 25 grams, not milligrams, but 25 grams of the protein, and you can use that soy protein, you can put it into a glass and make a smoothie or a shake. All you have to do is put it in the glass, a spoonful or one serving, one scoop, and then add in a cup of ice. You can add in a half a cup of soy milk or even regular milk or even water. You can blend in some frozen fruits or put in regular fresh fruits, and you'll find those to be very tasty and add a lot to it. So you want to keep the dosage or the range of those proteins from between 25 and 40 grams a day. Another common thing that's used is flaxseed. Remember, the flaxseed has to be ground. There is flaxseed oil. I like to recommend the flaxseed that's ground up, the actual seeds themselves. You can get these in most of the health food stores, and now they're being much more widely disseminated. So if you get those, you want to use between 1 and 2 tablespoons. And the best way to take that is just to add it to your breakfast cereal in the morning and just eat it along with the cereal. You won't taste it that much, but you'll get the benefit. And again, these are phytoestrogens or plant estrogens that are both in the flaxseed and in the soy. Another thing that's helpful that a lot of people use is called black cohosh. Black cohosh is a plant, and the root of that plant is very dark. It's ground up. As a matter of fact, I have it growing in my yard, and it's a wildflower. And you just take that root. It comes in the stores in about 20 milligram capsules. Again, 20 milligrams twice a day, so about 40 milligrams a day. Or sometimes you may find it as a component in other kinds of nutritional supplements put in together with soy or other things as well. These are 3 of the most common ones that I think are safe and have been effective for some people, because you have to remember that it's always true that some things will work for everyone and everything will work for someone, but it's very seldom that we get something that works for the whole population. So try it out, see if it works for you. Usually in about 3 or 4 weeks, you're going to know if it's helpful or not. The next thing I want to talk to you about are prescription medications, and these prescription medications are not hormones. These are other kinds of prescription medications that happen to be useful for hot flashes. One of the things that has been used a lot is something called gabapentin. It's also called Neurontin. This is a medication that was originally used for seizures, but if you use it for hot flashes, your doctor will talk to you about it, and you have to build up the dose up to a week. I'll let your doctor talk to you about the details, but remember, it takes increments of dosages, and you want to work it up over the course of about a week. And this will minimize the side effects and help you to get benefits. And about half of people will get a good benefit from this. About half of people will not like the medication. So you have to try it to see if it works for you. Other medications that are very common in particular are the antidepressants, the so-called SSRI class of medications. Those are the selective serotonin reuptake inhibitors. These are medicines that increase serotonin in the brain, and that makes a person's depression improve. It also seems to have an effect on hot flashes. That's something that you can talk with your doctor about. There are a number of other medications that are prescription. Of course, talk with your doctor about other options if those don't work for you. Hopefully, they will. By far, the most effective treatment for hot flashes is estrogen. Now, everybody knows that there was a study that came out about 8 or 9 years ago called the Women's Health Initiative, and in the process of that study, it raised some question about, is estrogen safe? That's a whole nother discussion which I'm going to present in a different video. But talk with your doctor and see if estrogen is a good choice for you, or if you're comfortable taking estrogen. If you are, you have about a 95 to 98% chance that you're going to get a reduction in your hot flashes. They may not go away completely, but they will go away a tremendous percentage of the time, and the intensity will go way, way down. Estrogen, of course, can be given as patches, it can be given as pills, it can be given as creams, it can actually be put as a vaginal ring into the vagina. There are gels, there are so many ways to take estrogen. Talk with your doctor about that and see if it's right for you. The fact of the matter is that the potential to improve hot flashes now is much greater than it ever has been. Another thing that I want to talk about that I should have put in the beginning, but I'll mention it now so we don't overlook it, and that is stress. Stress is a big trigger for hot flashes, so no matter which ones of these medications you're on, see whatever you can do to lower your stress and to sleep better, because sleep deprivation, not enough sleep, and stress are two of the biggest triggers for hot flashes. Anything that can be done, if there's stress reduction that you can do, if there's meditation, if there's yoga, if there's Tai Chi, any of those things are going to help you reduce the frequency and the intensity of hot flashes. Well, I hope this information has been helpful to you. Hot flashes are a natural thing that happen. They generally last from between 1 to 3 years on average, but for some women they can last up to 10 years. So you don't know how long they're going to last until you live through it, but there are things that you can do. There's lifestyle, there's nutrition, there's triggers, there's medications, non-prescription, over-the-counter, prescription medications, sleeping more, and lowering your stress. All of these things can be helpful. I hope this has served you well. If you will leave your name and your email address, I'd love to send you continued updates in our newsletter and also more information as it continues to progress and come out on hot flashes and other important menopause-related content. Remember, it's better to stay well than to get well.